Welcome to Nurse Navigator 2025. Important Nursing Competitive Exam MCQs. Deep vein thrombosis renders a person at a risk of A. Pulmonary embolism, B. Shock, C. Stroke, D. Heart attack. The answer is pulmonary embolism. CPR and defibrillation should be initiated in a kind of arrhythmia: A. Atrioventricular block, B. Premature ventricular contraction, C. Atrial fibrillation, D. Ventricular fibrillation. The answer is ventricular fibrillation. Severe dyspnea, orthopnea, pallor, tachycardia and frothy blood-tinged sputum is seen in A. Left heart failure, B. Right heart failure, C. Pulmonary edema, D. Congestive heart failure. The answer is pulmonary edema. An early manifestation of laryngeal cancer is A. Stomatitis, B. Hoarseness, C. Dysphagia, D. Airway obstruction. The answer is hoarseness. Paradoxical respiration is most commonly seen in A. Flail chest, B. Obstructive airway disease, C. Cardiac tamponade, D. Congestive heart failure. The answer is flail chest. An early indication for development of hypocalcemia is A. Memory changes, B. Tingling sensation in the fingers, C. Ventricular dysrhythmias, D. Depressed reflexes. The answer is tingling sensation in the fingers. The lifespan of human platelets is A. 10 to 12 minutes, B. 10 to 12 hours, C. 10 to 12 days, D. 10 to 12 months. The answer is 10 to 12 days. The lifespan of human RBCs is A. 120 minutes, B. 120 hours, C. 120 days, D. 120 months. The answer is 120 days. The human blood cells are enucleated: A. RBC, B. WBC, C. Platelets, D. Both RBC and platelets. The answer is both RBC and platelets. A patient with liver fail having edema is most likely to receive A. Diuretics, B. Laxatives, C. Antidiuretics, D. Beta blockers. The answer is diuretics. The drug of choice for methicillin resistant Staphylococcus aureus MRSA is A. Clindamycin, B. Vancomycin, C. Erythromycin, D. Gentamicin. The answer is vancomycin. Which of the following antitubercular medication has the side effect of peripheral neuritis? A. Pyrazinamide, B. Isoniazid, C. Rifampicin, D. Ethambutol. The answer is isoniazid. Which is the drug of choice for severe and complicated malaria? A. Quinine, B. Artesunate, C. Primaquine, D. Chloroquine. The answer is artesunate. Antidote for heparin is A. Protamine sulfate, B. Vitamin K, C. Aminocarboic acid, D. Aminoterone. The answer is protamine sulfate. The values of correlation coefficient varies between A. -0.5 to +0.5, B. -0.75 to +0.75, C. less than -1.0 to less than +1.0, D. none of these. The answer is less than 1.0 to less than +1.0. The constant presence of a disease or infection within a given geographical area is called A. sporadic, B. epidemic, C. endemic, D. pandemic. The answer is endemic. Complex spots are clinical feature of A. chicken pox, B. pertussis, C. cholera, D. measles. The answer is measles. Which of the following is not constituent of vital statistics? A. Birth rate, B. Morbidity and mortality rate, C. Educational rate. D. Life expectancy. The answer is educational rate. Route of administration of PPD4. Tuberculin test is A. SC, subcutaneous. B. ID, intradermal. C. IM, intramuscular. D. IV, intravenous. The answer is ID, intradermal. The first referral level in the health care system is A. Primary health care. B. Secondary health care. C. Tertiary health care. D. Primordial health care. The answer is secondary health care. Housefly is responsible for spread of A. Diarrhea. B. Dysentery. C. Cholera. D. All of these. The answer is all of these. Which drug may cause gray baby syndrome? A. Chloramphenicol. B. Gentamicin. C. Penicillin. D. Tetracycline. The answer is chloramphenicol. Which of the following is not a side effect of salbutamol? A. Muscle tremors. B. Sedation. C. Palpitation. D. Nervousness. The answer is sedation. A patient with DVT is advised low molecular heparin. At which site the nurse should administer this? A. Oral. B. IM, intramuscular. C. IV, intravenous. D. SC, subcutaneous. The answer is SC, subcutaneous. A patient came to ED unconscious with pinpoint pupil, lacrimation and history of substance abuse. Which drug to be administered to him? A. Naloxone. B. Lorazepam. C. Flumazenil. D. Naltrexone. The answer is naloxone. When did the Mental Health Bill became Mental Health Act? A. 1912. B. 1985. C. 1987. D. 1990. The answer is 1987. A freshly prepared ORS solution should be used within A. 24 hours. B. 48 hours. C. 12 hours. D. 6 hours. The answer is 24 hours. Ripeness of cervix is assessed by A. Bishop score. B. Apgar score. C. Down score. D. New Ballard score. The answer is Bishop score. Uterus is palpable at the level of symphysis at A. 8th week. B. 10th week. C. 12th week. D. 14th week. The answer is 12th week. Normal duration for involution of uterus is A. 2 weeks. B. 4 weeks. C. 6 weeks. D. 8 weeks. The answer is 6 weeks. Thanks for watching. Like, share, subscribe.